Hello everyone, myself Dr. Mayank Gupta, reader in Department of Orthodontics. So today's topic for discussion is oral habits. So now what is oral habit? Habit can be defined as a tendency towards an act that has become a repeated performance, relatively fixed, consistent and easy to perform by an individual. Now coming to the classification of habits, it can be classified as useful and harmful habits, empty and meaningful habits, pressure, non-pressure and biting habits. Next is compulsive and non-compulsive habits. So now what are useful habits? These include habits that are considered essential for normal functions such as proper positioning of the tongue, respiration and normal deglutition. Harmful habits includes habits that have a deleterious effect on the teeth and their supporting structures such as thumb sucking, tongue thrusting and etc. Next is empty habits. They are the habits that are not associated with any deep-rooted psychological problems. Next is meaningful habits. They are the habits that have a psychological bearing to the patient. Now, next is pressure habits. These include sucking habits such as thumb sucking, lip sucking, finger sucking, and also tongue thrusting. The next is non-pressure habits. These include the habits which do not have a applied direct force on the teeth or its supporting structure are termed as non-pressure habits. The example are mouth breathing habit. Now next is biting habits. These include habits such as nail biting, pencil biting and lip biting. Now coming to thumb sucking habit, which is also known as digit sucking habits. So it is defined as the placement of the thumb or one or more finger in varying depth into the mouth. The presence of this habit is considered quite normal till the age of 3.5 to 4 years of age. Now persistence of this habit beyond this age can lead to any malocclusion. So oral habit depend upon the three types, that is also known as triad of factors, that is intensity, duration and frequency. So intensity is amount of force applied on the tooth, frequency is the number of times that the habit present in a day, and duration the amount of time spent in the habit. So coming to the clinical features of thumb sucking habit, intraoral we can see there is a labial flaring of the maxillary anterior teeth, lingual collapse of mandibular anterior teeth, that is collapse arch. The overjet also increased, hypotonic upper lip and hyperactive lower lip, tongue placed inferiorly leading to the posterior crossbite. Also the maxillary arch is constricted and also there is a high palatal vault. Now coming to external findings, fungal infection on the thumb is present and thumbnail exhibit a dish pen appearance. Now coming to the diagnosis part, history, you can determine the psychological component involved with the patient. You have to ask the question regarding the frequency, intensity and duration of habit by the patients. You can inquire the feeding pattern, parental care of the child. Also the presence of other habits should be evaluated. Now next is external findings of these type of patients. You can check the digit of the patient. Digits that are involved in the habit will appear reddened, exceptionally clean, chipped and short fingernail, that is also known as dish pen appearance. You can also see an fibrous roughened callus may be present on the superior aspect of the finger. You have to check the lips also. The upper lip may be short and hypotonic. The lower lip is hyperactive. Facial form analysis, you have to check the mandibular retrogression, maxillary protrusion and high mandible plane angle. Now coming to other features, that is labial tipping of the maxillary anterior teeth resulting in proclination of the maxillary anterior teeth, that is the maxillary anterior teeth are proclined. The overjet increased due to proclination of the maxillary anteriors. Also anterior open bite is present, which can occur as a result of restriction of upper incisor eruption, and there is a super eruption of the buccal teeth. Now coming to diagnosis part, the parent should be questioned on the frequency and duration of the habit. The child's emotional status should be assessed by inquiring into such things like feeding habits, parental care of the child and whether the parent are working or not. An intraoral clinical examination should reveal all the features which are described above. So the child finger should be examined for the presence of clean nails and callus on the fingers. Now coming to the management part of thumb sucking habit, You can check the psychological approach. It is usually said that the children lacking parental care, love and affection resort to this habit. Thus, the parent should be counseled to provide the child and with adequate love and affection. Next is mechanical aid. They are basically reminding devices that assist the child who is willing to quit the habit conscious level. So these appliances usually consist of a crib placed palatal to the maxillary incisor. So you can give the palatal crib to these type of patients. Now it can be also known as the habit breaking appliance, that is habit breakers, which are of two types, that is removable habit breaker and fixed habit breaker. Removable habit breaker, they are passive removable appliance that consist of a crib and is anchored to the oral cavity by means of clasp on the posterior teeth. The fixed habit breakers, they are heavy gauge stainless steel wire which are designed to form a frame that is soldered to the bands on the molars. So basically they are fixed habit breaking appliances. Fixed breaking, the fixed appliances, the first appliance is that the bluegrass appliance. The other is other aids that can be used to intercept the habit, that is include the bandaging of the thumb and bandaging of the elbow. Chemical approach, use of bitter tasting or foul smelling preparation placed on the thumb that is sucked can make the habit distasteful. The other medicaments used are pepper dissolved in a volatile medium and quinine. Dummy sucking. So the sucking of a dummy or a comforter is usually confined to the first 3 to 4 years of life, being given up on the whole sooner than thumb sucking. Now coming to the next habit, which is tongue thrusting habit. So tongue thrust is defined as a condition in which the tongue makes contact with any teeth anterior to molar during swallowing. Now what is the etiology of tongue thrusting habit? It can be of different types. First is retained infantile swallow. So what is retained infantile swallow? Retention of infantile swallow mechanism with eruption of incisor at 6 months of age. Tongue does not drop back and it should be continuous to the thrust forward. The second etiology of this habit is upper respiratory tract infection. So upper respiratory tract infections such as mouth breathing, allergies, etc. promote forward movement of the tongue due to the pain. So it may also present due to psychological need to maintain the adequate airway of the patient. Now the next is third one is the neurological disturbances, hypersensitive palate, disruption of the sensory control and coordination of the swallowing. The next is feeding habit, that is also known as feeding practice of the patient. So bottle feeding is more contributory than breastfeeding to tongue thrust development. The next is induced due to, it can be induced due to other oral habits, that is thumb sucking and finger sucking may prevalent in many children. So they cause the anterior open bite. The tongue is protruded between the anterior teeth during swallowing. When habit corrected, then change in protrusive tongue activity takes place. It can also be by tongue size. You can check the tongue size of the patient. So macroglossia have an effect on the dentition. Now coming to the classification of tongue thrust, it can be a simple tongue thrust or complex tongue thrust. Simple tongue thrust, the following features can be observed. So there is a normal tooth contact during the swallowing act. There is a presence of anterior open bite. They exhibit good intercuspation of the teeth. The tongue is thrust forward during swallowing to help establish an anterior seal, lip seal. You can see there is a abnormal mentalis activity. Now coming to complex tongue thrust, the following features are seen. There is a teeth apart swallow, anterior open bite can diffuse or absent, absence of temporal constriction during the swallowing, contraction of the circumoral muscle during the swallowing, and occlusion of the teeth may be poor. So coming to the clinical features, there is a proclination of anterior teeth, anterior open bite is present, there is a bimaxillary protrusion is present, the posterior open bite is case of lateral tongue thrust, and also there is a posterior cross bite. Now coming to the management part, you can habit interception. The first is the tongue thrust can be intercepted by use of habit breakers, both fixed and removable with cribs. The child is taught to correct the method by swallowing. Also there is a various muscle exercises of the tongue which can help in training to adapt the new swallowing pattern. Treatment of malocclusion. Once the habit is intercepted, the malocclusion associated with the tongue thrust is treated using removable or fixed orthodontic appliance. Thank you.